Guys, you ever get that intuition to not do something? Just something tells you don't do it. You don't know what it is. You just get this natural instinct. Don't do it. Well, that has been me with this vaccine. I don't care what anybody's out there saying or anything like that. I do care, but I'm not talking about that for this point. The reason I have this intuition not to get it. There's just something within me that says don't get it. And then here we go. More information keeps coming out. Man, this stuff was so rushed. Gotta get it out. And here we go. We got, oh man. So evidently in this vaccine, they used an HIV protein. Lord, help us all. I ain't gonna talk no more. I'll just show you the rest.
A potential game-changing treatment in the fight against COVID. Pfizer out with an experimental pill it says will reduce the risk of hospitalization and death from the virus by 89% among high-risk people. They're calling the treatment Paxlovid. This is the second pill of its kind behind Merck's own antiviral drug. Pfizer's pill is used in combination with protease inhibitors, which is used to treat HIV and hepatitis C. It's 3 pills given every 12 hours for 5 days. The study examined 1,219 adults, all with an underlying medical condition. Of the half who received the pill, 6 were hospitalized and none of them died. The company tells Website Insider, "Our ability to stop living in fear is now within reach." What makes Merck's and Pfizer's treatments so alluring is that both come in pill form, unlike the intravenous treatment remdesivir, potentially saving a trip to the hospital. Pfizer says it will submit its data to the Food and Drug Administration as soon as possible, with the hope it could have 180,000 treatments available by year's end.
It was a race against time, and back in January, University of Queensland virus experts were confident.
We're aiming to have something that's ready to go into humans in 16 weeks' time.
And in early clinical trials, it looked promising.
The vaccine was shown to be safe and extremely well tolerated in all of our vaccinees.
216 people in all. The problem was the use of an HIV protein used in the molecular clamp technology. It was a small fragment of HIV, and scientists were aware of the risks of false positive results.
There was a theoretical risk of this, we thought, albeit a very low risk.
In a shock result, everyone who had the vaccine came up with the false positive. The federal government was told on Monday, and jointly today with CSL, it was decided to halt the project.
The risk to vaccine confidence was the principal issue here.
It was a very, very good technology. It was looking like it was going to make antibodies, and it probably would have worked very well as a vaccine.
But it would have been hard to convince the public it was safe.
It's certainly a tough day for the team to get this news.
Especially seeing the very positive data come out of the trial.
It's a very sad time, but also we're very proud of what we have achieved.
Trial participants didn't know if they were taking the vaccine or a placebo.
It's just such a terrible shame that it is ending this way, but I would do it again in a heartbeat. I have no concerns about recording a false positive.
Heather Shearer says researchers were very upfront about any risk.
I knew that they were using a modified part of the HIV virus, but the actual possibility of getting HIV was impossible.
The UQ scientists are leaders in clamp technology and did have other options from the start.
In hindsight, the UQ team, of course, it's a wonderful thing. We would look back and perhaps change the molecular clamp that they were using because there are other options. But they went ahead with this, and everyone knew that this was a possibility because patients were warned about it.
The Queensland government invested $10 million into the research with no regrets.
They've been working night and day. I mean, they have been making the ultimate sacrifice. But of course, there are going to be some winners and losers when it comes to vaccines.
What has happened today is not a surprise to the government. But what is important is that the plan was in place to deal with this.
So the race for a vaccine continues.
I think the world is in safe hands as we bow out of this project.
Lexi Hamilton-Smith, ABC News.
FaceTime for the first time in 9 months. All but one of the nation's leaders in the same room.
We're working together and Australia is coming back from COVID-19.
A sign of progress in the COVID recovery amid a vaccine setback.
Every cent we have invested has been money well spent. Every single cent.
Australia's hedged its bets in the global race, investing billions in 4 potential candidates. With the University of Queensland trial cancelled, extra stocks of the others are on order. The government's now purchased nearly 54 million doses of Oxford's AstraZeneca vaccine, which can be made locally, and 51 million doses of the Novavax shot produced in Europe, enough to cover the entire population if either is approved. Australia's also secured 10 million doses of the Pfizer vaccine being rolled out right now across the UK.
Overseas, vaccination is the only thing they've got, frankly.
Australia has a luxury afforded to few other countries: zero COVID spread. The first vaccine here could be rolled out before March, and when it is...
We want to ensure that Australians, and I think all of us feel very strongly this way, have full confidence that when it gets the tick, they can get the jab.
As National Cabinet met, Australia reached a significant milestone. For the first time since February, 7 days straight without any community transmission. The leaders are determined to build on the success, which means maintaining a Fortress Australia approach. The policy's been crucial in the response to COVID-19, but it's left tens of thousands of Australians stranded overseas with little hope of returning home anytime soon.
I'm not happy to see the quarantine system move outside of the hotels at this stage. I think that would be too high a risk.
The Prime Minister and I had a conversation last night about us lifting our numbers, and we're very confident we'll be able to do that.
Offering perhaps a glimmer of hope as 2020 draws to a close. Jane Norman, ABC News, Canberra.
Okay, does anybody not see what's wrong with this? Oh my God. All right, first off, Pfizer is double dipping. Okay, so they're feeding you a little bit of HIV protein. So they say, okay, this will work, everything will work just as long as you take the vaccine and then you go take our HIV pill to reassure yourself over a virus that has a mortality rate of less than 1%. People, come on. I know y'all waking up. I know you are. For the love of God, please. For the rest of you ain't got any kind of sense whatsoever. Just look at the others, please. Guys, look, companies like Pfizer, actually Pfizer in particularly, they fund the FDA and the CDC. They can get anything passed. All right? They're right there at the flick of a pen, right? But they could have very easily made that pill an everyday COVID pill, right? Instead of having people take the HIV pill. Think about that.